Hi guys, welcome back to my channel. So today I am doing a Q&A ultrasound related. I posted a story not too long ago just asking you guys like what would you be interested in, and I have two parts for this video. One would be from a future ultrasound tech, a current ultrasound tech, or an ultrasound tech that just graduated and wants to know more. And I'm gonna have a part two for this video, which would be just from a patient aspect. You know, if you're pregnant, what would you be interested in regarding to ultrasound? Not medical advice, but just like in general, how to prepare for certain things. So I'm gonna start with the first question. How to become a sonographer step by step, and is it worth it? So I'm gonna start with saying that yes, it's worth it. Nothing comes easy, but the reward and the benefits are not only that. I will remind you that I was a brand new mom when I went to school. I started my prerequisites when my son was just a few months old and literally had to go through the program and waiting to get into the program, all while being a new mom. And I have to say that I did need the support, but it was very, very hard because if it wasn't for my husband, who was being like a mom and a dad for so long, I wouldn't be able to do it. But we each have like our support system. Don't get discouraged if you don't have someone who lives with you and you're a mom. It's definitely doable with any support system. But shout out to my husband for being a mom and a dad for that long. So now fast forward 10 years later of being, you know, a working sonographer, I can tell you that it is so worth it. I was able to grow year after year with positions, with pay. It's just something that is always, you know, there for you. You don't ever feel stuck. There's so much for you to do as a sonographer. If you are, you know, a tech or in sales to sell the machines, the ultrasound machines, yes, you can definitely be a salesperson, and someone who teaches the applications of the machine. You can even become a professor, a university professor, to teach ultrasound without a teaching degree. You can get into sports medicine with that because yes, we can scan so much than what you think. It's not just babies. I feel like it has so much potential and there's so much for you to do. So there is like no end. So yes, it's worth it. Now to the steps. I took all my prerequisites towards an Associates of Science. That basically, you know, was the English, the math, anatomy and physiology, electives, one physics. That's what I needed for my program. And that's it. I sat and I waited, and I know that a lot of people don't have a wait list, but I waited almost a year. And once you start the program, you basically start the cross-sectional anatomy and physiology and all the courses that apply towards the degree. But once you're done with the prerequisites, what you're going to do is you're going to basically apply to an accredited program at an accredited school. And you can check that on KHAP. I'll attach the link so you can go and check if your school is accredited. It's very important. Accreditations for school is one of the most important thing because that basically determines whether you're going to be able to sit for your boards as soon as you graduate, or you're going to have to work somewhere for a year and then take the boards, which complicates things. Do people do it and succeed? Yes, but if you're already planning this whole route and journey, plan it the right way and the easiest way for you. So once I applied to the program and I waited almost a year, once I got in, it was a breeze. It was about 22 months for me. I know now some programs are a little longer, but it flew by and it was an amazing journey. I loved my friends at school. I loved my teachers. I loved my professors. I loved my mentors. I loved my preceptors. Of course, there's always, you know, not as great preceptors or not the best energy in every clinical site, but that is everywhere, always. Question number 2. What is your recommendation for going into this career path for someone who's currently a medical assistant? So I'm not sure what your specialty is as a medical assistant, but let's say it's OB. You already have so much experience and so much general knowledge about OB or OBGYN, and it's such a huge plus. And I know that with a medical assistant job, you are in the healthcare field, but you didn't necessarily need to take all the courses and all the, you the stuff that you need to do for ultrasound, but it's just, an easier start. Most of the time you could just transfer your credits over to the university that you're going to take the program in, and you can just continue on and then from there apply to the program. I know a lot of people who already have their associate's degree in some kind of science, so you just need to apply for the program and that's it. And it's the DMS program, Diagnostic Medical Sonography. So that's that. I mean, there's a lot of benefit from coming with a healthcare background, but everyone's starting the same way. It doesn't necessarily give you, the upper hand, but if anything, in an interview, it's great to say that you already come with a background, because yes, a lot of schools do interview nowadays. So I just feel like it's always better, to come with some background. I was like clueless. I came with nothing. So medical terminology for me was like another language, but we all learned that language, and English is my second language for me. So I thought that would be like, a disadvantage because it's Hebrew. Sometimes they say, how medical terminology is Latin. A lot of Hispanic students in my class were like, oh, I know what that means. I didn't even have that. So you're gonna get that fine. Don't worry. Question number 3. Do you have any advice for new graduates trying to get into an OBGYN office? So this is perfect because when I graduated, I thought I was gonna do hospital for life. I loved the rush. I loved the ER. And I always heard the recommendation to start in the ER, to start in a hospital. It's always the best. So I followed people's advice. And let me tell you, it changed really quickly because I realized the love that I had for OBGYN. Like, I obviously am registered in abdomen, OBGYN, and vascular. So I had all 3 registries. And I can tell you that for me, every time I scanned OBGYN, I was like excited, like I knew it was it. And my advice for you is, as a new graduate, to go into the hospital regardless, to get your experience, because you're gonna see the craziest stuff there. And it's just like you're gonna see stuff that you might not see in your first year in an office, and get that experience down. And that will let you, and for me, it wasn't a lot. It was 6 months of experience until I applied to an OBGYN office. But what I did was I continued in the hospital for, a few years after that while working until I got a full-time position in the office that I'm in today. But yeah, 10 years ago, I was just like a 2-day-a-week kind of tech at that office. Well, where I am today. But an opportunity came up, and nowadays I supervise the imaging department. So things change, life changes, opportunities come. So I definitely think that the more you work at the hospital, the more experience you're gonna see, and maybe that won't be for you. Maybe you won't like scanning uterus and ovaries and pregnancies all day. You just never know until you are in it. Question number 4. How do you deal with something you find during an ultrasound that is bad news? That is a whole topic. I feel like anything, mostly in our OBGYN field, a lot of the bad news are usually miscarriages and losses. It's something that's really hard for me because I've been dealing with it for obviously 10 years of scanning things like that. And I think it's a personality. I don't think it has to do with like, whether you get thick skin or not. I feel like it's just like you are that person that really takes it to heart, that you can, you're just an empath, and like I'm always so empathetic, and so many times, like if you work with me, that it's just like how I am in general. So when it comes to that, yes, I will lie if I say that I finished a scan and I didn't cry after the patient left. After making her stronger, and yes, maybe shedding a tear or two with her out of compassion, not to show weakness, God forbid, because I know sometimes they need a strong person there. But I feel like everybody can understand what it's like to have a loss. Everyone can feel for it. Everybody can feel bad and sad, but nobody knows what it feels like until you go through it. Like the roller coaster of emotions, of knowing that things are wrong and that's why it happened, but why me? And there's so much involving that. As a tech, I just have to have the most compassion towards it. I deal with it as far as like being professional. I feel like, I try as much as I can to, as a tech, you can't give, results, but with me, there's a TV in front of them. If the baby doesn't have a heartbeat, they see it and they kind of know. A mother kind of knows when they see something wrong. It's just how I've always felt. And I'm not going to be that tech to say, I can't give you results because there's a TV in front of you. And I work with a team and doctors and midwives that support my decision, that support my advice. Every office is different. In a hospital, you can get fired for saying something. It really depends on the environment you work with. So with my office, I would usually say, usually they would be the first to say, I see that something's wrong. And I say, yeah, I can't find a heartbeat. I am so sorry. And, I go through the talk of what's going on, and I will get the doctor right now to go over everything and answer all of your questions, because that is not my place. I want to make sure they get all the answers they need from the doctor. But yeah, it's definitely the hardest part of my job. The hardest. We're going to move on to question number 5. How to gain confidence with moody radiologists or doctors. You totally go through that when you work in the hospital. You see, I feel like the hospital is a huge prep. It's kind of like, a boot camp. You get to meet all the radiologists, all the doctors. Some are going to be amazing and inviting and welcoming, and some are just going to be like, what do you want? Why are you here to give me this report? Is it that important? Couldn't you just fax it in? Couldn't you just scan it into the patient's chart? Let's not get into that. We don't need the negativity. We don't care about it. I so many times got chewed out as a new tech for scanning something, literally for scanning and having so many images of one organ. Because I felt it was necessary, because I felt like something was wrong with the organ. Or something that I thought wasn't a stat, I got yelled at for no reason, thinking, because the doctor thought that it was a stat. I'm giving you examples, broad examples, or just moody radiologists. There's always that radiologist that when you get to work and you look, who's the radiologist today? Oh, it's that person. And you already know how your shift's gonna go. But that's just life, with every job. And you just gotta stay positive and ignore the negativity. Literally, they would yell and scream. I would do procedures with a very moody doctor and yell, scream. Yes, I know that's not right. Absolutely. But I would just be like this. Completely in my element, in my zone. You're not going to ruin my day. Nothing you say will kill my vibe, period. Is it easy? No. But if you go into your shift, and if you go in life in general with not allowing anyone to shift your mood and kill your vibe, that's the only solution I have. Just don't let it. It's not worth it. There are people just like us. They have a higher education level that got them to that place. And if they will use it against you, they can try. Don't let them. And question number 6. Can you get trained in echo on the job and then take the boards? Yes. I personally never wanted to do echo, but I did train for vascular on the job. And then I had my supervisor sign for me, because there's something that they need to sign saying that they've watched you scan. There is a whole process for it, but yes, you can definitely study for the boards, take the boards, have someone sign that you are competent in scanning, and that's it. Question number 7, how to prepare for an amniocentesis as an ultrasound tech. Personally, at my office, I maybe got to do them twice in 10 years, because it's only if something is, if that procedure is self-pay, that we would do it in our office. Otherwise, it's done at the specialist. I haven't done one in years, but back then in the day when I did it, it really doesn't take a lot from you physically to do as an ultrasound tech, other than scan the patient and to guide the doctor. The medical assistant sets up everything. The doctors know, what they're doing. And we are basically guiding, watching the needle while they are drawing the fluid. And that's really all it is. Mentally, It's terrifying. I always felt like I hold such a huge responsibility, and I always was like I'm just a baby. I don't want to do it. I'm a baby tech, but I did it. I got thrown into it, and that's the only way to learn. You get thrown into it, and it's just like scanning anything else. You follow the needle sagittal, and that's how you get it best. So that's it. It's just, I'm so glad we don't do these. My heart just can't. All right, next question. What used to be your study routine? So as I mentioned, I was a very new mom, and I really had a hard time trying to juggle things. But when I did have a routine, I would basically come back from school, and our school would end at 1. They would give us the option to scan each other until 4. School closed at 4, and then I came home, and I would be a mom between 4 to about 7:30. I cooked, I cleaned, I did laundry, I spent time with my son as much as I could, and when he would go to bed, I would start studying again. And what that would do, that would just give me the review, and if I had a test the next day, what I used to do, I used to basically go to sleep at 1 or 2 a.m. and then wake up at 6 to kind of review everything before the test. Yes, it was crazy. But I did the tables. I would get huge posters, huge, and I would put I would divide it into diagnosis, kind of what it looks like on ultrasound, differential diagnoses, what the meaning of this disease is, or anomaly, whatever that would be, and that's how I studied. I was a visual learner. I was flashcards, tables, all of that. Next question, what is the gel for the ultrasound used for? So without the gel, we can't see anything. If I was to just put a probe on the skin, we wouldn't see anything. It basically is like a medium between the probe and the body. It just gives us that ability to see through, and we don't have to put a lot of it. Sometimes, as we scan, as the years go by, I've been able to put less and less gel. I feel like in the beginning when we first graduated, and this is a sign that I always notice new graduates because they put a lot of gel, but eventually you just need a little bit, and you kind of learn, if you need to add more, you add more, but without gel, we don't see well. Is ultrasound something for me if I'm bad at physics and chemistry? So I didn't take chemistry at all, and I just literally needed to pass my physics class. I know that physics has nothing to do with ultrasound. It's literally, you gotta take that class and you just gotta pass it, because without taking that physics class and getting a good grade in it, you cannot go into the program. You gotta get a total GPA that's depending on the school. So you wanna do the best you can, but just focus on passing the class. Next question, I plan to go to school for sonography. Is it hard to learn and read the ultrasound? So I had no idea what I was looking at all. When I had my baby's ultrasound, I was oh, here's the head. I did have more of an eye to it, but I didn't know what I was scanning. I always say, for me, pancreas was the hardest thing ever to see. I said, I will never be a tech because I cannot see the pancreas. And then there's always someone who can see it before you. And I'm that's it. I'm dumb. I'm never gonna be able to be a sonographer. But no, the eye has to get used to it. Literally your eyes get used to it more and more every single day that you scan. And that's why practice. I used to scan my classmates every single day. That's the only way to learn. It's a skill that you acquire. And that's why I always say, I can teach anybody to be an ultrasound tech, but I can't teach someone to be nice and compassionate. I always say it, and maybe some of you heard me say this a million times, but it's just how it is, because at the end of the day, it's a skill, and I feel like most people will just get it and grasp it. But to be an ultrasound tech, it takes so much more of the emotional part, being passionate about it, compassionate towards your patients. It's just so much more. So if you have all of that and you're not, just oozed by certain things, not we deal with blood a lot, but to say that we don't at all, it's not right, because you do see blood and we do assist in procedures. But other than that, it's just a very, a career that you just need to be all about patient care. Next question. I am starting my clinical rotations very soon. What are some great tips? So I would say stay off your phone. I mean, 10 years ago, I probably wouldn't have been on my phone as much as I am nowadays. Not because of social media, it's just it's just the culture that we're in now, period. But nowadays, it's just like such a habit to always walk around with your phone, always look around with, at your phone. So stay off your phone as much as you can. Be a sponge as much as you can. Learn from everybody, even if they have an attitude, even if that preceptor is not as nice, even if that tech you're shadowing is not letting you scan. Just watch and observe everything and try to squeeze your way into scanning. You're not gonna get, unfortunately, every tech is different. Some are like, oh, I want my techs to, push their way through and like be aggressive. And some are like, I don't want anybody to scan my patients. Yes, I've seen both ends as a student. Try to be helpful to them, stock for them, get the gels, the towels, everything that needs to be, make the tech's life easy so they can actually, even if it's not within them, because for me, it didn't matter if you did all that. It's within me. But not everybody has that within them. But even if it's not within them, they'll notice how much you try that they will probably end up, giving their everything for you. So try your best. Stay away from gossiping. Stay away from the drama. Stay away from just being, loud and be yourself, of course. But just be on the observant side along with getting along with everybody and being social, but just learn that kind of boundary, because I'm very loud. I'm very social, but I always dropped it down a notch just so I can remain professional, because no one knows your capabilities in such a short time. So, just make sure you're in that kind of profile of being, just professional but fun and yourself. Remember that every day that you're in that clinical site, it's your interview every single day. And at the end of the day, one of those clinical rotations, one of those sites is going to be able to hire you. They're going to be wanting you. I was so happy to hear that so many of my sites either requested me again as a student or wanted me to work there. It didn't always work out for me, but most of my sites wanted me back. And that's amazing, because that means that when you graduate, you don't have to be on a hunt for a job. There's already X, Y, and Z places that want you. So be careful how you are and how much of yourself you give, because you want to show that you give everything in these clinical rotations. And last question, tips for new grads getting out in the field. So you're already graduated. You probably took your boards, or maybe you didn't. You kind of know how to scan, but you just got to get a job now. And it's not as easy as it seems when you're in your rotations. You have to actually interview in person, and you have to go through a scanning interview. Oh my God. My first scanning interview was oh my God. I scanned someone who didn't have a gallbladder. That was my test, okay? And I was looking for the gallbladder for probably 3 minutes. And then I'm like, do you have a gallbladder? That was literally so nerve-wracking, but you go through it. My tips for you when you go out in the field, create a good resume. Make sure your resume is very clear as far as the dates you did your rotations, where you worked, as far as your clinical rotations. I call it work because it's work. It's just free, but it's work. What you studied, what registries you have. And I don't even think that you just have to go and apply or send resumes. If you live in a local area where there's a lot of local offices, go ahead and walk into those offices and say, hi, my name's Natalie. I'm looking for a job. I'm registered in OBGYN. I would love to work for you guys. Here is my resume. I would love for you to look at it. So there's different ways that you can do, but I feel like that there's different ways of searching for the job. But I really feel that once you're gaining your confidence with scanning, I feel passing an interview, a regular job interview, should be relatively easy, because to me, I was always afraid of the scanning test, because what if I'm not good enough? Well, guess what? You get hired as a new grad, you immediately have the benefit of the doubt. People know that you're new. People will give you, the techs, your supervisor will give you all the help you need, all the training you need. So also from that aspect, you need to, give yourself a break. You're not supposed to know everything. School prepares you to pass the boards. School prepares you to pass the tests, but they don't teach you how to be a tech. You learn this in your everyday life as a tech. So I am in for 10 years and I'm still learning every single day. So this completes this portion of the Q&A. The next video is going to be from a patient's perspective, like how to prepare for an ultrasound. And I'm so excited for that video. So stay tuned and I'll be back.